Hello and welcome to this video on postnatal contraception. My name is Jessica Jones and I am a clinical pharmacist with a keen interest in the safety of medicines in pregnancy and lactation. This video was made in support of World Breastfeeding Week 2021, which focuses on a shared responsibility of healthcare professionals to protect breastfeeding where possible. So before we begin, the purpose of this presentation is to ensure that we give parents accurate and up-to-date information, and so that we're able to support them and enable them to make their own informed decisions. I will be mentioning breastfeeding. It's not about forcing someone to breastfeed. It's definitely not about guilt, and it's not telling everyone that breastfeeding is best. Mums have the capability to make their own informed decisions and to decide what is best for them and their families. We are here to give them the information and to support them to make that decision. So this might be something that you've come across in the past. This mum asked, I'm 2 weeks postpartum, but I'm already worried about becoming pregnant again. I've heard that breastfeeding itself is effective contraception. So does that mean that I don't need to take anything so long as I'm breastfeeding? What this mum is referring to is something called lactational amenorrhea, which is where you don't have any periods because you're lactating. And it can be up to 97% effective as a contraceptive if she is exclusively breastfeeding. So that means absolutely no formula at all, nothing else, just breast milk. And the baby is less than 6 months old, and she is not having any periods at all over that time. After 6 months, none of that applies and she should still use further methods. Even if all of that does apply, there are other factors that might decrease the efficacy. So these are things like using a dummy or a pacifier, having long intervals between feeds, or reducing feeds, or not having any night feeds, and expressing only. So baby actually has to latch and feed. So it is possible to get pregnant as soon as 21 days after having a baby. And like I mentioned, it is possible to get pregnant before you have your first period and if you're breastfeeding. Current advice is to wait for 18 months or longer before becoming pregnant again, and that's because if you get pregnant again too quickly, the next baby might be very, very small or born preterm. So there are quite a few contraceptive choices, and we will go through each one with regards to breastfeeding and postnatal considerations. This is just kind of a handy chart on the different contraceptive choices that you could give to mum to sort of show her all of the different choices and look at the benefits and the risks of each one. So first of all, we have the combined oral contraceptives, and these are tablets. These are known as the pill, and they contain artificial versions of the female hormones estrogen and progesterone, which are produced naturally in the ovaries. So each different tablet might have a slightly different artificial version of these hormones. So I've put them up the top there, but sort of Mercilon and Marvelon have ethinyl estradiol and desogestrel, for example, whereas Microgynon has ethinyl estradiol and levonorgestrel, but they're basically doing the same things. And it works by preventing the ovaries from releasing an egg each month. It thickens the mucus at the neck of the womb, so it's harder for the sperm to penetrate the womb and reach the egg. And it also thins the lining of the womb as well, so there's less chance of a fertilized egg implanting into the womb and being able to grow. In terms of women who are not breastfeeding, it's recommended that they can start combined oral contraceptives 3 weeks postpartum, so that's 21 days postpartum. That's fine if they have no risk of VTE. However, if they have a risk of venous thromboembolism, it's recommended that they wait until 6 weeks postpartum to start combined oral contraceptives. And that's because of the risk of blood clots, and that's a higher risk after giving birth. So it's better to wait. If they do start that any later than 21 days after giving birth, they will need to use additional contraception for the next 7 days. If mum is breastfeeding, it is recommended that she can start from 6 weeks, but previous guidance did state that it was suitable from 6 months, and that's because there has been anecdotal evidence of diminished milk supply. So it's up to mum, I suppose. It's worth mentioning to her. It's anecdotal, so it doesn't happen to everyone, but it's something that she would need to be aware of. So next we have the contraceptive patch, which works in exactly the same way as the pill does. It has these artificial versions of the female hormones, estrogen and progesterone. In this case, they are ethinyl estradiol and norelgestromin, and that's what is within the Evra patch. And basically, it just releases a daily dose of those hormones through the skin. Like I said, works in the same way, prevents the release of an egg each month, thickens the cervical mucus, and thins the womb lining. And exactly the same as the pill, if mum isn't breastfeeding, it should be fine to start 3 weeks postpartum if she doesn't have any risk of VTE. If she does, it's recommended to wait until 6 weeks postpartum. And again, same reason for the risk of blood clots. If mum is breastfeeding, it should be suitable from 6 weeks postpartum, but previous guidance stated from 6 months, and that again was due to the anecdotal evidence of diminished supply. Next up are the progesterone-only oral contraceptives. These are things like Cerazette, Femulin, Micronor, and Norgeston. The progesterone-only pill, or POP, is sometimes called the mini pill, and it just contains one hormone called progestogen, or a version of it. So Cerazette has desogestrel, Norgeston has levonorgestrel, for example. And it's basically similar to progesterone, which is a hormone produced from the ovaries. These are taken at roughly the same time every day without a break, and it's quite short acting, so it needs to be taken at roughly the same time every day. Just something to consider when it comes to mum choosing which one is best for her, because when you've just had a baby, you don't know what time of day it is, so it's worth keeping that in mind. It works by temporarily stopping the ovaries from releasing an egg each month, so periods might be less frequent and they might stop temporarily as well. The main way it works is by thickening the mucus from the cervix and by making the lining of the womb thinner, so it's much less likely that a fertilized egg will settle and grow. If mum is not going to breastfeed, progesterone-only contraceptives can be started a minimum of 3 weeks after delivery. If she is going to breastfeed, that's fine. They're safe during breastfeeding and they can be started a minimum of 3 weeks after delivery as well. But again, ideally 6 weeks to avoid interfering with milk production. And again, that's just anecdotal evidence of diminished supply. If it is started more than those 3 weeks, it's recommended that the pill is taken for at least 2 days whilst using additional contraception. And after those 2 days, you don't need to use anything else. There is also a progesterone-only depot injection, which again is just an artificial version of progesterone. So in the case of Depo-Provera, it's hydroxyprogesterone acetate, and it's given as an injection, usually into the gluteal muscle, and lasts for 13 weeks. So mum doesn't have to worry about anything during that time. She doesn't have to worry about taking anything at the same time. Again, works by temporarily stopping the release of the egg each month, thickening the fluid around the neck of the womb, and making the lining of the womb thinner so that a fertilized egg can't settle. In women who choose not to breastfeed, they can have this anytime after delivery. Sometimes it can be given straight after delivery. In women that are breastfeeding, though, it is safe during breastfeeding and can be started up to 6 weeks after delivery. One thing to note is that northisterone, so Noristerat, is not advised if baby is jaundiced. And there is also a progesterone-only implant. So this is etonogestrel or Nexplanon, and it's just a small flexible plastic rod that's placed under the skin of the upper arm, and it steadily releases the hormone up to around 3 years. So I don't think I have to go through the way that it works again. So the implant can be fitted in both breastfeeding and non-breastfeeding women anytime after delivery, completely safe for use whilst breastfeeding. If it's fitted before 21 days, you don't need any further contraception. And if it's fitted on or after day 21, so after those 3 weeks, additional contraception would be required for the next 7 days. And there is also an intrauterine progesterone-only system. So this is a kind of coil. It's not the copper coil. This one contains hormone. And again, it is progesterone only. This time it's levonorgestrel. So the one that is most commonly used, I think, is Mirena or Marina. And it's just a small T-shaped plastic device that's put into the womb by a doctor or a nurse, and it can last for 3 to 5 years depending on which brand you have. So like I said, it's similar to the IUD, which is the copper coil, but instead of copper, it releases progestogen. So the IUS can be fitted at the same time as birth or following a cesarean section, but if it isn't fitted within the first 48 hours, you should wait until at least 4 weeks after giving birth. After that, whether you're breastfeeding or not breastfeeding doesn't matter. It can be fitted 4 weeks postpartum and it won't affect the milk supply. The intrauterine devices are the copper coils. So just like the IUS, this is a T-shaped plastic and copper device that's put into the womb by a doctor or a nurse, and it releases copper, and it can protect against pregnancy for between 5 and 10 years. Copper alters the cervical mucus, so that makes it more difficult for the sperm to reach the egg and survive, and it can also stop the fertilized egg from being able to implant itself as well. Just like the IUS, the IUD can be fitted at the time of a cesarean section or immediately after a vaginal birth, but if it's not fitted within the first 48 hours, you should wait at least 4 weeks after giving birth. Any time after that is fine for both breastfeeding and non-breastfeeding women. And just in case, there's also emergency contraception. So this is not required before 21 days postpartum. But there is the copper IUD, which can be inserted up to 5 days after unprotected intercourse as an alternative method of emergency contraception. There's Levenel or levonorgestrel. This was previously licensed to be given to women during breastfeeding, but the patient information leaflet has changed. And it now suggests that women shouldn't breastfeed for 8 hours after having it, but there's not really much research on that, so you can just continue to breastfeed as normal. Ulipristal or Ella-1 is advised to withhold breastfeeding for 24 hours. So if mum is breastfeeding, it's probably worth going for Levenel instead. But the World Health Organization guidelines have stated that women that are breastfeeding can generally use ulipristal as an emergency contraceptive. It's just a one-off dose anyway, so the levels that we'll get through to breast milk are very, very low. So this is just a quick overview, just a quick snapshot of the ones that are safe in breastfeeding. So, and I say safe in breastfeeding, this is compatible with breastfeeding. There is obviously risks with any medication at any point, whether you're breastfeeding or not, but these are compatible with breastfeeding. So Progesterone only pills, fine from 3 weeks. The implant can be fitted anytime after delivery. The injection can be started from 6 weeks postpartum, and the IUS and IUD can be fitted either at the time of delivery or 4 weeks postpartum. Condoms can be used anytime after delivery, and emergency contraception can be used anytime after 21 days following childbirth. Before then, it's not needed. And those that are not compatible with breastfeeding are the combined hormonal contraceptives, and this is due to the risk of diminished supply. So ideally you should wait at least 6 weeks postpartum, but it is recommended to wait 6 months just in case you get that diminished supply. I put in this slide just as a very quick snapshot, just as a go-to should you need the information really quickly. So that was a very quick run through all the different types of contraception available and their use postpartum and in breastfeeding. I hope that it was helpful and informative. If you have any questions at all, please feel free to email me at jessie.jones@nhs.net. Thank you so much for your time. Bye bye.